Hello, everyone, and welcome to today's conversation. As we near the 1 year mark of the COVID-19 pandemic, our lives have changed in ways we never could have imagined. We have adjusted to wearing multiple masks when we go out and working from home. And we've also struggled to hold on to interpersonal connections and build and maintain community while facing incredible fear and loss. These circumstances have really spotlighted these stark socioeconomic inequities in our country, many of which have disproportionately affected LGBTQ people, particularly those of color. So today, ahead of President Biden's first State of the Union address, Lambda Legal and the Financial Times are taking a look at the toll this pandemic has had on communities that were already behind economically in our LGBTQ State of the Union address. My name is Taylor Nicole Rogers, and I'm a correspondent at the Financial Times. And this morning, I have the opportunity of being joined by Avatara Smith-Carrington, who is Lambda Legal's Tyrone Gardner Legal Fellow, ACLU staff attorney Taylor Brown, and NCLR Senior Policy Counsel Tyrone Hanley. So, Avatara, can I start with you? How has COVID-19 impacted LGBTQ communities economically?
COVID-19 has essentially shown kind of the precarity of our current economic situation. Most people recognize that as soon as the pandemic really hit, a lot of the ways that folks are able to maintain employment typically involve physical interaction with other individuals. So there were a lot of jobs that people hold that can no longer be performed in the way that they have typically been performed. And so that meant that suddenly these jobs were either forced to figure out a way to actually continue letting people work in a new environment, or unfortunately let people go. And I think what we've seen across the board is that a lot of people have actually been in a position where they're no longer employed or no longer stably employed. So sometimes you have people who have their hours reduced, or they've completely lost their employment. And so again, the other side of that is that we already knew prior to COVID-19 that the gig economy is something that's picking up, and that a lot of people supplement their income because they don't make enough money with gig jobs. So that can be, working for Uber and driving people, which again, that changes completely in a pandemic where you're not supposed to be sharing physical space with folks, right? Or, doing things like Uber Eats, or all these different jobs that are essentially gig jobs. And that also changes in the midst of this pandemic as well. So again, you have people who maybe had stable income and then would supplement their income, and all these streams of income are being impacted. So now what we're seeing is that, our unemployment rates are going up across the board. And that when you look at it, people who have typically been impacted negatively by not having access to stable income, they're the ones who are also the hardest hit. So not only does that mean, specifically for the LGBTQ community, but then you also have to look at people who are honestly in the margins of our community. So you're talking about trans folks, you're talking about people who are also undocumented, you're talking about people who, disabled people, you're just talking about all these other compounding factors on top of being LGBTQ. So essentially, what I'll say is that COVID-19 has really shown that folks were just scraping by before, and now they're having to figure out how to completely rearrange their lives with little to no safety net. Because as I'm sure that you've been tracking, there have been a couple of different relief bills that have passed in ways that, states have worked to extend unemployment coverage and things like that, but that's not enough. We're a year now into the pandemic. And what we're seeing is that because of COVID-19, because of job insecurity, or, not having stable income, people are now facing the risk of housing insecurity, food insecurity. How are they going to pay their medical bills when they do come? And then, I'm just going to say I'm in Texas. So there's a couple of other things that are happening too in the world. So COVID-19 has really, again, shown that for those folks who are already the most impacted in the LGBTQ community, when it came to job insecurity or jobs that are low wage, they were already kind of in a position where at any moment the scale could not tip in their favor. And now COVID-19 has shown that it's clear that we need to change the game plan because it's not working.
Thank you for bringing up all of those really good points. And So now I'm wondering, what are the policy fixes that could be implemented to really get to the root of these issues, like you were saying? So, Tyrone, what do you think?
In addition to housing, cash, and food assistance, we must finally raise the federal minimum wage, which has been stuck at $7.25 since 2009. The Black Futures Lab found low wages are the biggest concern of Black LGBT people and trans people, especially those who are Black, experience extreme poverty rates. The Williams Institute found raising the minimum wage to $15 by 2025 would benefit over 1.5 million workers. As a child of a lesbian mother who is a low-wage worker, I know firsthand how desperately needed an increase in the minimum wage is to help LGBTQ people and families to cover the basics. In addition to a minimum wage increase, we also need to release as many people as possible from jails, prisons, and immigration detention centers. These facilities are breeding grounds for COVID and can result in the unnecessary deaths of many people in these settings. So these are some of the policy priorities that we must really pursue in order to help people in these times.
Tyrone, I also want to ask you about employment discrimination. This is something that we've heard a lot about within transgender communities, both before and during the pandemic. So, could you tell us a little bit about the protections that transgender people do have in the workplace and what further protections they may need?
The Supreme Court found last summer, federal law does protect LGBTQ people from discrimination based on sex and employment. But the rates at which LGBTQ people of color still are discriminated against when applying for work, not to mention the harassment on the job, is undeniable. This is why we need to pass the Equality Act, which was reintroduced last week in Congress. Yay! The Equality Act makes it clear LGBTQ discrimination in all areas of life must be outlawed.
Thank you so much for that context. But now I'd like to talk a little bit about the public health side of the crisis that we're in right now. We've all seen the reports and statistics that have proven to us that LGBTQ people are more likely to test positive for COVID-19. And among those that do test positive, LGBTQ people of color are also more likely to die. So, Taylor Brown, can you tell us a little bit about the healthcare system and how we've gotten to this place?
Yes, absolutely. So for forever, since statistics have been collected, we know that LGBTQ people have faced healthcare disparities just for a lack of shared discrimination, reluctance to go see providers, a lack of competent providers, insurance coverage issues, all kind of reasons that have led to a distrust between LGBTQ people and the healthcare system. And then you compound that with the historical discrimination that Black LGBT people and Black people in general have faced in our healthcare system since, again, I'll say forever. There just has not been a good connection between the healthcare that America has and extending it out to LGBTQ people and to Black people. And so as the COVID-19 pandemic set in, we've seen those disparities rise even in greater detail. So for transgender people, especially, we are seeing surgeries being canceled. We are seeing further insurance coverage problems. For Black LGBT people, again, just from a basic mistrust of the United States medical system, there's a reluctance to go get tested. There's a lack of testing centers. The ease of testing is just not there when compared to richer communities, when compared to wider communities, when compared to communities with resources. Again, there's a lack of just on top of federal confusion. The Trump administration initially was handling the distribution of vaccines, which was a travesty. The Biden administration has been playing catch up, but is still nowhere near where we need to be. And so what we know is that people of color, low-income people, and minority communities like LGBT people are the hardest hit because they're the last people that are thought of. And so that's why it's great to see that equity is finally being raised in talks about vaccine distribution and COVID relief and things of that nature. But actions speak way louder than words. And I think what we need right now is concrete action.
Taylor, I'd also love to follow up with you on what you just said about increased difficulties paying for and scheduling medically necessary surgeries. Why is this happening?
One of the first steps that a lot of hospitals and a lot of healthcare companies took whenever the COVID-19 pandemic set in was to cancel what they called elective surgeries. Unfortunately, surgeries related to or transition related healthcare and surgeries related to transition have constantly been categorized as elective, as in non-life threatening. And so those surgeries were some of the first surgeries to be canceled. And so as hospitals have been dealing with a crisis in terms of processing COVID-19 patients and just an influx, a lack of equipment, a lack of providers, sort of the wear and tear on providers, trans people have seen their surgeries canceled and pushed back months and months and months and to years. And when we're already talking about for a lot of people, surgeries that have been booked months and months in advance to a year in advance, we're going to see huge delays for a lot of trans, non-binary, and gender non-conforming people seeking surgery. And until hospitals are back up to full capacity, until we have vaccines distributed equitably, and we have seen a greater number of people vaccinated, the outlook for trans people and getting access to surgery is just not good.
Taylor, thank you so much for that really important background and context. But if we could, I'd love to pivot for a moment to the economy. So at the Financial Times, my area of coverage is the labor market. Avatara, I'd be interested in hearing from you about how LGBT communities are experiencing the labor market right now.
So what I'll say is that, as like Tyrone and Taylor have kind of already like alluded to, is that when you're thinking about the economy, you also have to just think about the discrimination that people face in that space, right? And so often what happens is that, especially for trans folks, and specifically for Black and brown, maybe undocumented trans folks as well, when they enter into that specific market, what they're entering into is honestly a place of discrimination sometimes. And so what that can mean is that they might not actually have the opportunity to actually get gainful employment, which means that they might actually turn to other ways of finding income. So a lot of that can look like, engaging in what some people might title as like survival work. And often those forms of survival work are typically criminalized as well. And what I think about when I think about that is that essentially you're placing a group of people who are already experiencing immense discrimination in almost every space. So from jobs to housing to just public accommodations in general, you're placing them into a position where they are actually risking their safety in many ways, or placing them into a position where, because that work is so often criminalized, they're going to more likely than not be put in closer proximity to interactions with law enforcement. And that can look like, police, to everything that includes immigration as well. And we already know, when you look at the statistics around that people are going to experience discrimination and violence at the hands of the state as well. And so, I think that what this kind of crystallizes for so many folks is that you kind of have to look at the labor market from every angle. You have to think about all the ways that people are actually figuring out how to make ends meet. And then we also have to start thinking about, like, why are there some forms of work that we actually criminalize, and what's actually the history behind that type of criminalization, and who often bears kind of the burden for having to not only opt into or choose that type of labor, but also bear the burden of like the criminalization and the other violence that comes with it. And like, what can we do? Because again, the way that I think about it is that this is not like a one stop, right? Like, if someone doesn't have access to stable income, if they typically find themselves without a job or with multiple jobs, where if you lose one job and one paycheck, all of a sudden you're kind of in a position that you're now risking housing insecurity, food insecurity, you don't know how to pay your medical bills, you don't know how to possibly pay for childcare as well. That leads to other spaces where, again, for LGBTQ people, but more specifically for trans people, and then more specifically for Black and brown trans folks and undocumented trans folks, the ways that discrimination will show up will mean that so often people are going to be put in a position where they are at risk of losing or at risk of having little to no safety and little to no way of being able to move out of that position. So, it's interesting to talk about labor in a specific way. It's interesting to talk about employment in a specific way. But I think so often when we think of it, we only think of like the typical kind of day-to-day desk job. But not everyone has that type of job. And let's be honest, again, because we're talking about this in the midst of a pandemic, a global pandemic at that, not everyone has ever had the opportunity to have a job like that. So we really need to actually think about like what is currently happening with our economy, and is it actually meeting the needs of the people who are both contributing to it in terms of their labor, but also being impacted by it because of the way that it does demand more from people who are often more marginalized and sometimes in close proximity to different types of violence.
Thank you for sharing that. I think that's really important for us all to think about, especially as we're having further discussions about stimulus and whatnot. So I also want to take a minute to thank all of our panelists for taking a time to share their expertise with us today. Before I let you all go, I'm wondering if I could take a moment to ask you to share any resources that might be helpful to any LGBTQ people in our audience today who are struggling with any of the challenges that we've discussed. Please also feel free to add in any closing thoughts you might have. Tyrone, why don't we start with you?
Well, more is needed. We must do everything in our power to ensure that people are aware and get the support that is provided for them in the already passed federal relief bills and the one Congress is currently working on. Folks can find the National LGBTQ Anti-Poverty Action Network's COVID Relief Resource page on NCLR's website at nclrights.org.
Taylor?
Yeah, on top of federal relief, so many states are offering, even though there is a federal moratorium on evictions, there is a federal moratorium on federally sponsored education loans. There are also mortgage relief options that are being sponsored by the federal government. Also check all of your state government agencies for various different types of financial assistance for food, financial assistance for heating and lighting, and things like that, on top of many different community groups that are usually locally based and can be accessed through social media like Facebook, Instagram, and places like that are just coming together as a community collective and raising community funds for, I've seen a lot spring up for Black trans women, a lot for people who are just getting out of prison or being released due to COVID-19. Lots of different programs like that. I can't say any off the top of my head, but there are tons. And what I want to say, I guess, is a call to action. Thanks for hosting this panel. I think this was such a great thing, and I could talk about this for hours. But like Tyrone said, there's so much more that needs to be done in terms of the economy and LGBTQ people and Black people. For years, we have faced historic documented discrimination. And from that, I think this country owes us so much to redress that and to get us on equal terms with white America. And I think that starts with a serious policy platform. And then Biden administration, I would call on the Biden administration to cancel student debt for everyone. I would call on the Biden administration to truly look at decarceration. I would call on the Biden administration to look at policing reform. There are so many different ways that the economy is impacted by other pipelines, and those pipelines need serious, either to be completely torn away and done away with, or they need to be reinvented and reinvested in. And housing is another huge issue as well. So there are so many places where we need major structural reform if we ever want to see progress in terms of the economy and Black people and the economy and LGBTQ people.
Avatara, would you mind wrapping us up?
Yeah, sure. So to kind of go off of what Taylor was saying, I was going to suggest that people actually look to mutual aid funds. Again, I think that that's been a wonderful source, and I would say the call to action for that is for people who actually have the means, because there are a lot of people who have actually been able to maintain their job and have a stable source of income. And I would, honestly encourage you to redistribute the funds that you do have available to you that, you are not going to miss to those mutual aid funds, because they typically, tend to help people who are impacted on the ground, sometimes a little bit better, because people are understanding how to best meet the needs of those individuals in the moment. So again, that's definitely a resource. And of course, unfortunately, I don't know all of them, and they vary from state to state, city to city. But I would, of course, encourage people to look into those, not only for resources, but also to, redistribute some money too. And then, I think, yeah, I, um, I think the other call is to, really folks who have the ability in terms of like have some kind of access to systemic power to really actually rethink the game plan. Tyrone, I love when you were talking about the minimum wage, and I was like, yeah, we need to actually discuss that. And honestly, I was thinking about the fact, I was like, does 15 even work anymore? Like, are we being realistic when we're naming 15 as like the minimum wage, when we know that like time has changed and that actually might not be the number anymore? So it's just like, I think that we are in a moment where we actually have to be bold, and we actually have to do those things that I feel will make a lot of people uncomfortable, especially when we're talking about the economy and labor. Because as Taylor was saying, there is a history of, honestly, exploitation of labor in this country when it comes to certain individuals. So often it's when individuals are Black, Indigenous people of color. And the same holds true for Black, Indigenous people of color who are also LGBTQ. And the only way that you, again, can redress that is by creating a system, or actually interrogating a system that tends to not work for those same individuals, even though we can be real and say that our economy is built off their backs. So I think that that would be the, one of the biggest steps. And then, of course, if you're experiencing any form of discrimination in the workplace or anywhere else, feel free to reach out to Lambda Legal.
Thank you. And I'm really sad to say that that's all the time we have for today. I feel like I've learned so much, and I hope that our audience has learned a lot as well. Thank you again to all of our panelists for taking the time to join us, and I hope everyone has a great afternoon.